We all shudder a little bit when we're told we have osteoarthritis in a joint like our hips or our knees. It's scary. That same process that leads to so many joint replacements each year. I have the same issue myself. After a sports injury about 15 years ago, I have a little osteoarthritis inside of my right knee. So I thought it'd be helpful to share what it is that I do for myself and for my patients. And this is something that makes us a little bit different here at Vanderbilt University Medical Center. So we know that osteoarthritis is related to the trauma inside of a knee after an acute injury or after micro trauma from repetitive loads. Those loads irritate the surface of the knee joint, the cartilage, and structures like the meniscus. When those structures are injured, it exposes the collagen fibers underneath. Those collagen fibers, when exposed, encourage the synovial cells to let off a chemical cascade, a set of signals that we call cytokines, that encourage other cells, like macrophages, to come in. They come into the joint and mill down the joint surface in preparation to then encourage the cartilage cells to try and create more collagen. Unfortunately, that process, when it occurs, is not able, as we get older, to create the same amount of healing as perhaps we would have had in younger years. We know that the pain is from the acute chemical cascade, but the persistence of the pain is because of the micro instability and the constant wear and tear as we continue to run over those joint surfaces in an irregular way. The first mistake that we make is thinking that a single medicine is going to help stop the process, like an oral NSAID or a steroid injection. Oh, those medicines definitely help reduce the chemical cascade, but they don't inherently help the tissue go through the healing process or reduce the repetitive load on a knee. The next mistake people make is thinking that the newest, latest, and greatest tool will have all the answers. For example, a product we use called platelet-rich plasma has a lot of promise for stabilizing the joint surface and modulating the amount of inflammation. But that alone is not enough. The best approach is a system that addresses the acute pain, stabilizes the knee, and makes the tissue inside and around the knee more resilient for the future. Without this, we'll likely end up in a vicious cycle that leads to a joint replacement or a lower ceiling for your overall physical activity. It starts with our nutrition program. With our monthly appointments, we're helping patients know what to eat, when to eat, how to eat, so that we can reduce pressure within our joints. To address the acute pain, we talk about and use oral medicines, topical medicines, and even injections like corticosteroid. Then we talk about scheduling a platelet-rich plasma injection series. This adds additional benefit for pain control and prolongs the benefit for at least twice as long. Then you're ready for an exercise program, one that's designed to help restore you to a more capable state. This can even be done at home, helping it become more of a habit as well. Yes, I may only be in my 40s, but this approach is what we use for your peers as well. Even if you do end up needing a joint replacement, you'll be the best version of yourself ready to receive that surgery. If this approach is in line with how you want to treat your knee and hip osteoarthritis, then please schedule an appointment with us by calling 615-790-3290.